So we are in the measurement game here at KORR of, measuring VO2, VCO2, heart rate, all of those things. We are in the measurement game. And so that's an important thing to differentiate between what is an actual measured value versus what are calculations and estimates and extrapolations of data. And so I think that's a very key thing that at KORR we have decided fundamentally to not be in the extrapolation game, that we are in the measurement game. And so, some brands of metabolic analyzers will tout they have all these different biomarkers or things like that these reports can tell you about, when most of those things really aren't terribly founded in science. And so same thing is true with our wearables, that there are certain things that are measured, like heart rate, activity rates, so step counts or relative movement, things like that. Those things are measurable values. And then there are things like calories or sleep quality or some other things that it does a decent job at trying to gather a bunch of data points and using that to make an extrapolation or making some kind of estimate. But they're not always exact values, and certain things can throw those off by a little bit. And so it's important that we make sure that we take those things that are estimates and put them in their proper lane and don't overemphasize what those things mean. So kind of again, back to VO2 testing, making sure that we're really relying on measured values and not putting too much weight in some of these extrapolations and these other things that really, again, some of them aren't founded in science that we're using as outcomes or biomarkers or things like that.